Hi, this is Dr. David Greene with US Pain Network, where we connect those in pain with pain management providers around the country. Today the topic is the 10 best ways to avoid surgery with sciatica. Sciatica affects 1% of the population at any one point in time. So that's over 3 million people, and it can be very disabling. It can keep you out of work, it can keep you in bed, tough time playing with your kids and pets and socializing, and it can be very bothersome for months at a time, which is not good, obviously. So surgery may be the answer, but a lot of times, and I'm going to give you 10 ways, surgery can be avoided, okay? So what's the first way? Well, it's over-the-counter medications, and that would include non-steroidal anti-inflammatories like ibuprofen and also Tylenol. For mild to moderate pain, those can really help. Okay, I know you might, sit there and say, pshaw. It's not true. It can be very helpful because what's happening is, pretend that my fist is a disc, okay, and it's pushing on a nerve root. When that happens, a lot of times it sparks up inflammation, and that's what causes sciatica to shoot down your leg. Okay, so even anti-inflammatories by mouth can help simmer down some of that inflammation. All right, so that's number one. Number two is, when the pain is severe, narcotics may be very helpful. And this is typically for short term. Over the long run with narcotics, most of the time the risks outweigh the benefits with addiction, tolerance, constipation. But over the short term, they can be extremely helpful. All right. Number three would be a combination of muscle relaxers, such as Valium would be a top one. Or Scalaxin, or maybe non-narcotic pain medications such as Tramadol. Okay, so those can be very helpful as well, because sciatica can often spark up spasms around the low back, and those can be helped tremendously. You can get better sleep, settle down the spasms. So we're moving into number four. Chiropractic manipulations can be extremely helpful for getting rid of sciatica pain. It's usually not permanent, but it can be very helpful to decompress a nerve root. All right. So chiropractic for acute back pain and sciatica has been shown in studies to be very helpful. And there's other things that chiropractors can do besides just manipulations. There's physical rehabilitation exercises, which is very close to physical therapy. And there's some other things like ice, heat, ultrasound. There's an activator device. So those types of things can help. The next one is physical therapy. And physical therapy has been shown to be very helpful as well, with stretching and strengthening, along with the ultrasound. There's iontophoresis types of treatments, electrical stimulation. Those can be very helpful. Okay, TENS units is another one. A TENS unit has little foam pads that go on the back, and that provides slight electrical impulses through the back. Okay, and it can alter the way that the brain perceives pain signals. So it can be very helpful for sciatica and back pain and spasms as well. Those little electrical impulses can tire out the back too, so deaden the spasms and decrease pain. Another one, I think we're up to number 6 now, is spinal decompression therapy. Spinal decompression therapy involves intermittent traction applied through the low back. It was FDA cleared back in the late 90s. It is very low risk, okay? It's costs less than 5% of what spine surgery costs, and it's fairly painless. It's intermittent spinal traction. It's not continuous lumbar traction. A lot of patients fall asleep in the sessions, and it's usually about 20 sessions over a period of 7 weeks or so. Okay. Now, there's been studies looking at it, and over 85% of patients with sciatica got very significant pain relief. It's also useful for degenerative disc disease, spinal stenosis, facet arthritis. So a lot of things that it can be very helpful for. It doesn't suck the disc back in that got herniated, but it can relieve the pressure on the nerve root and kind of help with those symptoms. Okay? Now, as far as interventional pain management goes, trigger point injections can be extremely helpful as well. What's a trigger point injection? It's a tiny little TB-style needle that goes into the back, and doctors can move around a little bit and it can help with relieving muscle spasms. Okay, does it fix a sciatica problem? No, it doesn't. But I'm talking about the muscle spasms right now. Acupuncture can be very helpful as well. Okay, it's been shown many years now to be very helpful for degenerative disc disease problems, chronic low back pain, sciatica. It can relieve those as well. It's not exactly clear how it works. The theory is that it works on these energy pathways in the body called meridians. So it's not really clear. So the last few are epidural steroid injections. Okay, epidural injections have been used since the 1950s. So over 60 years of history goes into these types of injections. There's now 3 different kinds of epidural steroid injections. There's an interlaminar, which was the first type invented. I'll show you on the model here. Okay, here's the lumbar spine. Here's the sacrum. What you see here in the red is a herniated disc, and this is a nerve root that's getting pinched. Okay, the first type of epidural is called an interlaminar, and essentially what's happening is the pain doctor, it would be through here, pushes the needle through the area between the lamina, which is the bones of the back of the spine, through the soft tissue, the interlaminar space. That's where the needle goes through. The numbing medicine, the steroid, is then injected. All right. Transforaminal epidural steroid injection is when the needle goes into this area where the nerve root is actually coming out from the spine. It comes out the foramen, the needle goes through the foramen, transforaminal, and injects the steroid there. It's a closer to the area of the actual pinching of the nerve root. And the third type is called a caudal epidural steroid injection, which goes to the very bottom of the spine through the sacral hiatus, and the medicine will gravitate up. And it's very good for if you've had surgery in the past, things like that. If you've had multiple nerve roots being pinched at multiple levels, it can be very helpful because it can gravitate and reach multiple levels. Okay, so there you have it, 10 methods of beating sciatica. All right, the indications for surgery are if you fail conservative treatments for 6 to 8 weeks and the pain is just killing you, then it's okay to go ahead with surgery. If neurologic weakness is there, like a foot drop, or let's say it's up in the neck, you don't have sciatica in the neck, right? But I'm just saying, if you can't lift your wrist up, things like that. If neurologic weakness is progressing, then surgery is indicated. And then the third one is if you have something called cauda equina syndrome. It's very unusual, but it involves bowel and bladder deficiencies, then surgery is an emergency situation. All right, less than 5% of those with sciatica end up going on to need surgery. The results of surgery are usually very good, but there's small risks associated with it. And what they've shown is that at the 1-year point after surgery, the results are the same as if you got treated conservatively. Thank you for watching. I'm Dr. David Greene with US Pain Network. Your pain stops here.